Aclop uses, Dosage, and Precautions. Aclop is an antiplatelet medication used to treat and prevent conditions related to blood clots that block blood vessels. It contains the active ingredient Clopidogrel, which works by inhibiting platelet aggregation, thus preventing the formation of blood clots in blood vessels. Uses of Aclop: primary prevention. Prevents heart attack, stroke, and peripheral artery disease in individuals at high risk for these conditions due to blood clots. Prevents heart attack, stroke, and peripheral artery disease in individuals at high risk for these conditions due to blood clots. Uses of Aclop: secondary prevention and management. Controls and prevents the recurrence of stroke, heart attack, or peripheral artery disease in those who have already experienced these conditions. Uses of Aclop: controls and prevents the recurrence of stroke, heart attack, or peripheral artery disease in those who have already experienced these conditions. Prevents heart attack, stroke, and peripheral artery disease in individuals at high risk for these conditions due to blood clots. Uses of Aclop: controls and prevents the recurrence of stroke, heart attack, or peripheral artery disease in those who have already experienced these conditions. Dosage: the usual dose is 175 mg Aclop tablet daily. Dosage may vary depending on the condition and as prescribed by the physician. Duration of use: Aclop is used for extended periods, potentially weeks or months, depending on the individual's medical condition. Administration: Aclop can be taken with or without food. Swallow the tablet whole with a full glass of water. Do not chew or crush the tablet. Specific dosage for different conditions: individuals with a history of atherosclerosis 1 Aclop tablet 75 mg daily. Prophylaxis to prevent thromboembolic disorders 1 Aclop tablet 75 mg daily. Acute coronary syndrome, specifically unstable angina and segment elevation myocardial infarction. Specific dosage for different conditions: initial treatment 300 mg, administered as a single dose. Maintenance treatment 75 mg daily. Initial treatment 300 mg, administered as a single dose. Maintenance treatment 75 mg daily. Initial treatment 300 mg, administered as a single dose. Maintenance treatment 75 mg daily. Side effects: Aclop can cause various side effects, including bleeding, bruising, headache, dizziness, diarrhea, nausea, abdominal pain, rash, itching, and fatigue. Contact your doctor immediately if you experience any side effects. Drug interactions: Aclop can interact with other medications, including blood thinners, nonsteroidal anti-inflammatory drugs, antibiotics, antifungals, antidepressants, and cancer treatment drugs. Inform your doctor about all the medications you are taking, including prescription and over-the-counter medications. Pregnancy and lactation: sufficient information on Aclop's use during pregnancy and lactation is unavailable. Consult your physician before using Aclop if you are pregnant or breastfeeding. Patients requiring caution: patients with a history of bleeding. Patients with liver, kidney, or heart disease. Patients currently taking blood thinners. Note: this information is for informational purposes only and does not replace the advice of a physician. Consult your doctor before using Aclop. Always follow your doctor's instructions regarding dosage, duration of use, and administration of the medication. Note: store the medication in a dry, cool place away from direct sunlight. Keep the medication out of reach of children. Do not use the medication after its expiration date.